The top stories tonight in Y News. The Philippines will begin administering COVID-19 booster shots to all fully vaccinated economic frontliners and indigent population beginning tomorrow. Know what booster dose combinations are recommended by the Department of Health.
Initial findings show that dismissed policeman and murder convict Donel Nuesca may have succumbed to a heart attack, according to the Bureau of Correction.
Presidential aspirant Ferdinand Bongbong Marcos Jr. is facing another hurdle in his bid to run for president in the 2022 elections.
Good evening, Philippines and the world. Today is Thursday, December 2, 2021. I am Herlene Delgado.
Join us in the next hour as we deliver today's top stories around the Philippines and in other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news. The national government has expanded the coverage of eligible population for COVID-19 booster shots to essential workers and indigents beginning tomorrow. Rosalie Cos will tell us why.
Due to the threat of the new variant Omicron and the stockpile of COVID-19 vaccines, the administration of booster shots will be expanded. Health Secretary Francisco Duque III said beginning tomorrow, December 3, all fully vaccinated economic frontliners and the indigent population will receive their COVID-19 booster shots.
We will already start with the booster doses per FDA's revision of the emergency use authorization of the vaccines. DG Eric came out with the advisory just the other night. This will be for A4, beyond A1, 2, and 3. Kasi tuloy-tuloy na yung A1, 2, and 3. So dagdag natin A4 and A5.
Those aged 18 years and above and are fully vaccinated at least 6 months after their second shot will also be given their booster doses.
The guidelines have been prepared by the Public Health Services Office of the DOH, and the NBOC will look at the operational details so that they can implement or execute the booster dose policy. So that's where we are, and that's going to start this month. Ang mangyayari lang, they have to wait 6 months from the last dose. So hindi yan as if magbo-booster dose, lahat ng Pilipino magbo-booster dose bukas. Hindi ganun yan. Mag-aantay tayo depending sa schedule ng ating last dose of a primary dose series, yung 2 dose.
The Department of Health has released its recommended booster dose combinations. Those inoculated with Sinovac may get the same vaccine as a booster or AstraZeneca, Pfizer, and Moderna. Those who were given AstraZeneca shots may receive the same vaccine or Pfizer or Moderna as third shot, while those who were vaccinated by Pfizer shot can receive the same vaccine or AstraZeneca or Moderna. Those given Moderna doses can get a third dose of the same vaccine, AstraZeneca or Pfizer, but those who receive Sputnik V or Janssen shots can be boosted with another shot of AstraZeneca, Pfizer or Moderna. Earlier, the Philippine Food and Drug Administration authorized the administration of booster doses for the adult general population. Currently, the Philippines has been giving boosters to medical workers, senior citizens, and people with comorbidities. Rosalie Cos, UNTV News and Rescue. We serve the people, we give glory to God.
The national government has missed its target of vaccinating 9 million people during the 3-day national COVID-19 vaccination drive last November 29 to December 1. Janice Inhente reports why.
Department of Health Undersecretary Mirna Cabotaje said there are reports that brand preferences still affect vaccine confidence among Filipinos.
Yes, there were isolated reports for this. We need to convince them, but we cannot also force them to get the available vaccine. Yung iba, bumalik na lang. And anyway, marami pa naman tayong araw na pwede silang bumalik for their preferred vaccine. But we would like to relay to everyone that kung anong bakuna dyan, this will offer the same protection.
From 9 million original target to be vaccinated on the 3-day national vaccination drive, the country has recorded over 7.6 million total number of people vaccinated from November 29 to December 1. In the latest data of the National Vaccination Operations Center, 2.7 million were vaccinated on November 29, over 2.4 million on November 30, while over 2.4 million on December 1. Even though the 9 million target was not reached, the government is still satisfied with the result of the accelerated COVID-19 vaccination drive. Meanwhile, the government extended the national vaccination drive for 2 days or until tomorrow after local government units requested the extension due to the overwhelming willingness of the Filipinos to get vaccinated. In addition to the 2-day extension, the government will also leave the decision to the LGUs on whether to extend the vaccination drive in the following days.
Dahil sa high willingness to get vaccinated, there is now a voluntary extension of vaccination days. Para masustain natin yung enthusiasm to get vaccinated, we should strive very hard. Kasi meron mga 21 million pa rin hindi nababakunahan all over the Philippines.
The government appeals to private companies and employers to excuse employees who want to be vaccinated now that national vaccination is extended. Janice and Hente, UNTV, News and Rescue. We serve the people, we give glory to God.
Meanwhile, medical experts and clinical investigators explain that oral antiviral pill molnupiravir actively responds to COVID-19 variants. The Philippine Food and Drug Administration, or FDA, on the other hand, says that further study is needed to prove this. Aiko Miguel will tell us why.
According to Merck's data analysis, molnupiravir reduces the risk of hospitalization and death in COVID-19 patients by 30% when the pills are started within 5 days of symptom onset. The Philippines is among the participating countries in the global clinical trial for molnupiravir. According to medical experts and clinical investigators in the country, molnupiravir is developed to combat COVID-19 variants like Omicron.
The game changer of this pandemic or any other pandemic or any other disease in the world will always be treatment. Kasi pag may gamot, mas madaling i-address yung problemang yun. You're able to diagnose patients early, you're able to treat them even if they are breakthrough infections, and you're able to see patients who have what we call who are exposed to those who are index cases.
Your variants, the mutant strains, would still respond kasi dun sa core or inner mechanism nag-work yung molnupiravir and not dun sa surface or dun sa superficial na spike proteins. So kahit magka-variation na mutation na changes dun sa spike protein, active pa rin yung molnupiravir mo against the virus.
On the other hand, the Philippine Food and Drug Administration says current investigational drugs against COVID-19 are still effective to treat COVID-19 patients, but experts still need further evidence to prove the efficacy of new antiviral pills against the heavily mutated Omicron.
Yung mga gamot for severe COVID, katulad ng mga steroid, katulad ng mga tocilizumab, ganyan, baricitinib, kapag severe case, aandar pa rin yan sa guide dito sa Omicron. Pero hindi pa natin sigurado yung ibang gamot katulad ng mga monoclonal antibodies, di ba? Tsaka yung mga antiviral na mga ginagamit ngayon ng mga bago kung mag-work sila as well.
Meanwhile, clinical investigators in the country are looking into the Phase 3 clinical trial of molnupiravir. The global study is enrolling individuals who are at least 18 years of age and vaccinated and reside in the same household with the index case or carrier of COVID-19. In the Philippines, Asian Hospital and Medical Center and Quirino Memorial Medical Center are the clinical trial sites for the Phase 3 Move Ahead study, evaluating molnupiravir for post-exposure prophylaxis of COVID-19 infection.
It will last for months and they will have to take 8,000 milligrams twice daily for 5 days. Those who are interested may contact the hospitals in NCR that will serve as clinical trial sites. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
There will be no flights available for overseas Filipino workers bound for countries under the red list, according to the Philippine Overseas Employment Administration. Eileen Cerudo will tell us why.
Due to the threat of the COVID-19 Omicron variant of concern, the Interagency Task Force for the Management of Emerging Infectious Diseases added 7 more countries in its red list. Based on the resolution released by the IATF, Austria, Czech Republic, Hungary, the Netherlands, Switzerland, Belgium, and Italy are among the countries included in the red list due to reported cases of the Omicron variant. Inbound flights are temporarily suspended to prevent the entry of the COVID-19 variant in the country. POEA Administrator Attorney Bernard Olalia explains, since inbound flights are suspended in red list countries, outbound flights are also suspended.
At bilang nasa kategorya ng red list country, kansilado po lahat ng incoming international flight. At pagkakansilado po ang international incoming flight, siyempre wala ring outbound international flight.
The POEA will release a labor advisory to guide OFWs affected by the entry ban. Meanwhile, OFWs coming from the red list countries will be allowed entry if they are on board repatriation flights organized by the government, bayanihan flights, or non-government initiated flights.
Pag galing po kayo sa ibang bansa na ganyan, at ito pong flight ninyo ay isang government-initiated flight, o kaya NGO-initiated flight, o kaya bayanihan flight, no? Na inarrange po ng Polo o DFA, kayo po ay papayagan namang makalapag dito kapag kayo ay OFW.
Overseas workers interested to avail repatriation flights can contact the Philippine Embassy to check for availability and slot. Filipinos arriving in the country are required to undergo a 14-day facility-based quarantine and will have to take COVID-19 RT-PCR testing 7 days after they arrived. Eileen Cerudo, UNTV News and Rescue. We serve the people. We give glory to God.
The United States became the latest country to identify an Omicron variant case within its borders. Beverly Saison reports.
The U.S. has confirmed its first case of the Omicron coronavirus variant Wednesday as health officials from the California Department of Public Health and U.S. Centers Disease Control and Prevention, or CDC, announced that an individual who recently traveled and who returned from South Africa on November 22, 2021, tested positive from the virus. In a statement, CDC says that the individual experienced mild symptoms of the virus and is currently self-quarantining. All close contacts had also been tested and received a negative result.
So this is the first confirmed case of COVID-19 caused by the Omicron variant detected in the United States. And as all of you know, because we've been discussing this, we knew that it was just a matter of time before the first case of Omicron would be detected in the United States.
Meanwhile, California Governor Gavin Newsom assured the public that there is no reason to panic but must remain vigilant and adhere to health and safety measures. California health officials say that they are continuing to monitor the presence of the variant in the state throughout the California SARS-CoV-2 Whole Genome Sequencing Initiative, or COVID-NET. This is a public-private partnership to help understand and control the spread of COVID-19 and detect its variants early. Additionally, they are focusing on COVID-19 vaccination and booster efforts to ensure that all Californians are safe. The health authorities also emphasize to the public to get vaccinated, wear a mask, get tested, and to stay home if they are sick. Beverly Saison, UNTV, News and Rescue, USA. We serve the people. We give glory to God.
The Philippines today logged 564 more cases of COVID-19, pushing the nationwide tally of confirmed infections to 2,833,486 473. The latest count brought the country's active cases to 15,188. Of these cases, 7,126 are mild, 3,817 are moderate, 2,463 are severe, 1,067 are in critical condition, and 715 have no symptoms. Meanwhile, total recoveries rose to 2,769,533 after 694 more patients recovered from the disease. COVID-related deaths, however, climbed to 48,752 with 40 new fatalities. All accredited testing laboratories in the country were operational on November 30, but 5 laboratories failed to submit data on time, the DOH noted in its report. Meanwhile, the overall global COVID-19 caseload has reached 263,532,223, while the deaths have surged to 5,224,797, according to the Johns Hopkins University. The United States is the worst-hit country with the world's highest number of cases and deaths at 48,692,505 and 782,100 respectively. In terms of infections, India follows with 34,606,541 cases and 469,724 deaths. And in terms of deaths, Brazil comes third with 614,964 fatalities. Presidential aspirant Senator Manny Pacquiao welcomes any unification talks with the PDP-Laban Cusi group, but the Cusi wing seems uninterested in the senator's idea. Nel Maribohok will tell us why.
Senator Manny Pacquiao must focus on the strength of his candidacy rather than trying to pick a fight with a non-candidate. This is the reaction of Attorney Melvin Matibag, Secretary General of PDP-Laban Cusi Group, after the senator said that he would welcome unification talks with the other group with the condition that Energy Secretary Alfonso Cusi will no longer have anything to do with the party. According to Matibag, Secretary Cusi remains as the president of the PDP-Laban, placed in an election presided and witnessed by President Rodrigo Duterte. Matibag said the statement of the senator is clearly misplaced and not properly thought out. The Cusi faction filed a petition requesting COMELEC to declare Pacquiao and Pimentel's group as illegal representatives of the party. The poll body may release the ruling on PDP-Laban brief before the year ends. Meanwhile, Vice Presidential aspirant and Davao City Mayor Sara Duterte Carpio called for unity among supporters following the withdrawal of Senator Christopher Bongo from the presidential race. The presidential daughter said that since the launching of her VP bid, she has been calling for unity among the Duterte admin's supporters. According to her, now that Senator Go has declared withdrawal from the presidential bid, they will continue their unity together. Bongbong Marcos and Mayor Sara are in Batangas to meet their supporters. Presidential aspirant Manila Mayor Isko Moreno is offering anti-COVID-19 medicines to patients infected by the coronavirus who are currently in various hospitals in Central Luzon.
Kung halimbawa lang, mangangailangan kayo ng gamot, no, patungkol sa infeksyon ng COVID-19. Kami po may remdesivir, may tocilizumab.
Moreno's Action Democratico team is on a listening tour in Central Luzon. Team Isko Moreno are now in Mabalacat and Angeles City in Pampanga. The tandem of Senators Panfilo Lacson and Tito Soto are not in favor with the no vaccine, no work policy.
Medyo, parang hindi ako pabor doon. Parang medyo kumbinsihin na lang natin. Huwag nating pilitin.
I go along with the Senate President kasi may human rights issue ito kasi katawan ng tao yan But then, kailangan din natin, sabi ko nga kanina, protektahan hindi lamang yung may katawan, kundi yung mga makakasalumuhan niya na pwedeng mahawa kung sakaling hindi siya bakunado at ma-expose siya sa COVID.
Lacson believes a massive information campaign plus the right incentives can help address the vaccine hesitancy. Also, presidential aspirant Labor leader Leody de Guzman opposes the implementation of the IATF resolution mandating COVID-19 vaccination for on-site workers. De Guzman said the IATF's policy is tantamount to economic coercion, saying that ordinary workers cannot afford the cost of the regular swab test. Meanwhile, Vice President Leni Robredo on her official Facebook page boasts the successful implementation of their Vaccine Express program in various areas. The Vaccine Express is the OVP's initiative in partnership with local government units, wherein VP Robredo's team would provide vaccinators to hasten the administration of vaccines. Nel Maribuhok, UNTV News and Rescue, we serve the people, we give glory to God.
A group claiming to be the real opposite consequent disqualification of presidential aspirant Ferdinand Bongbong Marcos Jr. in the 2022 elections. Dante Amento tells us why live. Yes, Dante?
Good evening, Harleen. National Commission on Muslim Filipinos or NCMF Commissioner Abubakar Mangelen went to the COMELEC this afternoon. Mangelen asserts the Marcos' CONA was unauthorized, defective, invalid, and void. The petitioner added there was no convention, no due process, and he and even the other officers of the party was not consulted over his replacement by Marcos.
I was never been informed of these particular issues. Andyan lang po ako sa opisina ko. Then I was never been informed that there is something going on. I came to learn only that Ferdinand Marcos Jr. was the newly nominated chairman of the PFP. Sa social media ko lang nalaman.
Mangelen has introduced himself as the duly elected chairman of Partido Federal ng Pilipinas or PFP. He filed a petition before the poll body seeking to nullify the Certificate of Nomination and Acceptance or CONA on presidential aspirant Ferdinand Bongbong Marcos Jr. issued by the PFP.
We want the COMELEC to study the system that we have in the Partido Federal ng Pilipinas because there are lots of violations made by our companions. I'm the sitting national chairman of the Partido Federal ng Pilipinas.
On the second cause of action, the petitioner argues Marcos should be disqualified for his conviction in 1995 after failure to file income tax returns in 1982 to 1985. Akbayan Party List and other groups also filed a disqualification case this morning against Marcos for the same ground.
Moral turpitude at saka final decision na convicted. Pagka convicted ka kasi dapat disqualified ka.
Meanwhile, Harleen, we tried to get a reaction from Partido Federal ng Pilipinas through their Secretary General Thompson Lantion over the issue, but they have allegedly wait for the copy of the petition before making any comment. And that's our latest live from Quezon City. Back to you, Harleen.
Thank you, Dante Amento, reporting live from Quezon City.
The National Bureau of Investigation will conduct the autopsy on the remains of murder convict Joel Nuesca, who died last November 30 at the New Bilibid prison. But initial findings show that dismissed policeman may have succumbed to a heart attack. Lea Ilagan explains why.
We are still relying on the initial findings of our medical doctors na all indications points to a cardiac arrest.
The Bureau of Correction has yet to confirm the cause of death of dismissed policeman and murder convict Junel Nuesga. Bucor spokesperson Gabriel Chaklag said they are still waiting for the result of NBI's autopsy on Nuesga's remains.
Scheduled ngayong araw pero dependent tayo sa schedule din ng medical legal team ng NBI. Pero yung cadaver ay nandun na po, nadala na po sa funeral service provider natin.
But he said based on their medical doctors, the former police officer died due to cardiac infraction.
Nahihilo siya tapos may shortness of breath. Kaya nagpasama siya papunta sa ospital. So habang naglalakad papunta sa ospital, hindi na umabot sa ospital, nag-collapse na siya, pero dinala pa rin sa ospital, yun na hindi na siya na-revive.
Meanwhile, the PNP expressed their willingness to help Nuesca's family.
Kami nagpapaabot kami sa pamilya ni Staff Sergeant Nuesca yung aming pakikiramay sa kanya. Kung may kailangan tulong na iabot, hindi lang dati namin kasama, iabot po namin yung tulong, hindi lang po pakikiramay. And then as to the incident, we will wait for the official report on what transpired para makita rin po namin dahil dati po namin siyang tauhan.
On August 26, 2021, the Paniqui Regional Trial Court Interlock found Nuesca guilty beyond reasonable doubt of the crime of 2 counts of murder for the deaths of Sonia Gregorio and her son Frank Anthony Gregorio. Leia Ilagan, UNTV, News and Rescue. We serve the people. We give glory to God.
28 public schools in Metro Manila may begin their face-to-face classes on December 6. JP Nunez will tell us why live. JP, go ahead.
Yes, Diego, good evening. The Department of Education releases today the list of additional schools to reopen for face-to-face classes beginning December 6, Monday. Comembo Elementary School in Makati City conducted limited face-to-face classes early this morning. It was among the list of Department of Education qualified for reopening. Students participated had the consent of their parents to return to school amidst the threat of COVID-19.
So yung mga participants po natin ngayon, basically yan po yung mga nag-volunteer or yung nag-said ng yes na willing sila na yung anak nila ay mag-participate sa pilot face-to-face. So wala po itong pilitan. May parents consent, even po yung mga teachers natin ay consent din na payag sila na magbalik eskwela para po magsimula tayo ng pilot run.
School authorities said they have geared up for proper implementation of public health and safety protocols to prevent the spread of COVID-19. Temperature scanners, alcohol dispensers, foot baths, UV lights, and air purifiers were all set inside the school. They also assure all school personnel are fully vaccinated as an added layer of protection.
I think our classrooms, dahil lahat din naman po ng participants, pati mga teacher are all fully vaccinated. At lahat po ng aming kasama sa school, to the principal, down to the utility and guards, lahat po yan fully vaccinated. So I think yun na yung pinaka-biggest assurance sa mga magulang na papasukin yung mga bata.
Aside from Makati City, Pasig Elementary School and 2 more schools in Navotas City already conducted face-to-face classes simulation. Meanwhile, other parents chose to let their children participate for face-to-face classes despite the presence of COVID-19 and the new Omicron variant. They explain in-person learning will be more conducive for their children.
Kasi pag sa cellphone lang, parang nakatutok lang siya dun sa cellphone, tapos iba pa rin yung oral na pagtuturo talaga ng teacher, tsaka nakakasira din sa mata yung nakababad sa cellphone.
Kasi mas natututukan sila ng teacher and then mas focus sila sa pagpapakinig ng mga lessons na itinuturo ng mga teacher. Unlike sa online class, medyo na ano yung attention nila kapag online class po.
It was November 15 this year when face-to-face classes reopened to students in areas considered as low risk from COVID-19 infection. Diego, there are 177 additional public schools across the country approved by DepEd to begin face-to-face classes on December 6. 28 of them are from Metro Manila. That is our latest live. Back to you, Diego.
Thank you, JP Nunez reporting live from Quezon City.
And for the news abroad, the Women's Tennis Association announced an immediate suspension of all tournaments in China and Hong Kong. Charisse Longbowen reports why live. Yes, Charisse, please go ahead.
Good evening, Marielle. WTA Chairman and CEO Steve Simon said that Beijing has been ignoring their calls and there's no full and transparent investigation going on regarding Peng Shuai's allegations against a former official. Steve Simon said that it was unacceptable as the leaders of China has not addressed this serious issue in any credible way. The Chinese star player was in a 30-minute video call with IOC officials on November 21st and was also seen in a tennis event prior to that. But the CEO of WTA doubts that Peng Shuai is free and not subject to censorship, coercion, and intimidation. WTA Board of Directors has decided to suspend all 2022 tournaments in China and Hong Kong, concerned also about the risk that all their players and staff could face if they were to hold the event there. Meanwhile, International Tennis Hall of Fame Billie Jean King comments WTA's decision and said that they are on the right side of history in defending the rights of their players. Marielle?
Therese, has Peng Shuai commented on this matter yet, and has she gotten in touch with WTA?
Marielle, there were no word from Peng Shuai about this case yet since the day she posted on her Weibo account about an alleged rape. And that is why WTA doubts that Peng Shuai is actually free and not under any kind of censorship. Marielle?
Thank you, Therese Longbowen, for that live report. India's capital Delhi records its worst air quality since 2015. Residents affirm no good day of air quality was experienced in November 2021. Paul Gatchalian will tell us why live. Yes, Paul, good evening.
Ariel, due to excessive crop burning in the surrounding states of the capital of India, along with the Diwali festival, pollution rapidly increased in the capital of India, experts say. Currently in Delhi, the levels of PM 2.5 are exceedingly high, 10.4 times higher than the safety limits set by the World Health Organization. PM 2.5 are tiny particles that can block the airways of people's lungs. In efforts to decrease such pollution, a ban was set in place to prohibit many from igniting firecrackers during the festival of Diwali. However, many still set firecrackers ablaze, impacting air quality a day after Diwali. The burning of crop stubble was also prohibited by the government, but due to their lack of enforcement, people continue to do so every year. According to NASA, from October to late November, there were 90,984 fires set, though this is predicted to only worsen as the government plans to decriminalize the burning of crops to decrease the number of protests held by farmers at the borders of Delhi. Marielle?
Paul, what are the health concerns when such toxic air is inhaled?
Well, Marielle, the Lung Care Foundation with Pulmocare Research and Education, together in a joint study, concluded that children are at their highest risk as the toxic air pollution can induce higher rates of obesity and are at more risk in developing asthma. Marielle?
Thank you, Paul Gatchalian, reporting live. Australia's The Therapeutic Goods Administration has granted approval for the use of the COVID-19 treatment tocilizumab for patients in Australia. Maeve Dog will tell us why live. Good evening, Maeve. Go ahead.
Marielle, tocilizumab, which will be used for hospitalized patients requiring oxygen, has been shown to reduce inflammation and slow down the effects of the virus. According to the Australian regulator, the treatment decreases the duration of hospitalization, the risk of being placed on medical ventilation, and the risk of death. While the treatment presents a new weapon in the fight against the virus, the regulator stated that it is not intended to be used as a substitute for vaccination. The approval follows Prime Minister Scott Morrison's statement on Tuesday that there will be no more lockdowns for Australia despite more Omicron cases being detected in the country. Meanwhile, Deputy Chief Medical Officer Dr. Steph Davis reassures that Australia is in a good position to manage this variant.
One of this is because as a population we have been outstanding at getting our vaccines. 87% of Australians aged 16 and over are double vaccinated, which is incredibly high compared with most of the world. And I think the final thing we have going in our favour is that we're 20 months into this pandemic, or maybe 21 months now. We know what to do. We know how to do our COVID safe behaviours. We've been here before and we've learnt a lot. So in terms of how worried we should be, I think we should probably be alert. We know there's a lot of work going on to try and understand this variant, but I don't think at this stage we should be alarmed.
The Department of Health's latest update shows that Australia currently has an estimate of 15,653 active cases and more than 39 million vaccine doses administered nationally. Back to you, Marielle.
Thank you, Mavian Dog, reporting live from Australia. Total solar eclipse is expected to be seen in Antarctica this week, which will be different from the partial eclipses that have occurred previously this year. Joselito Liquido will give us the details live. Yes, Joselito, please go ahead.
Good evening, Marielle. Countdown begins as we expect a total solar eclipse to happen on December 3 or 4, depending on your location. According to NASA spectators from St. Helena, Namibia, Lesotho, Australia, New Zealand, South Africa, South Georgia, Sandwich and Crozet Islands, including Falkland Islands and Chile, will see partial eclipse on December 4, while Antarctica gets a full view. Fortunately for those unable to purchase their tickets to watch the celestial event, NASA hopes to broadcast the live stream from Union Glacier, Antarctica, courtesy of the GEM Passachop Antarctica expedition. Live broadcast will start from 10:30 p.m. Pacific Time on December 3 or 1:30 a.m. Eastern Time on December 4. Said solar eclipse is the only total solar eclipse in 2021 and will be the last until the year 2023. Marielle?
Thank you, Joselito Liquido, reporting live from Malaysia. And those are the reasons behind the news in other parts of the globe. I am Maria Latoza reporting live from Perth, Australia. Good evening.
The Metropolitan Manila Development Authority, or MMDA, apprehends violators of the modified number coding scheme since it took effect yesterday. But the agency says only those who will violate the policy starting today will be fined. Asher Kadapan Jr. explains why live. Yes, Asher, good evening. Go ahead.
Good evening, Will. There were 51 private motorists apprehended due to violation of the modified number coding scheme on the first day of its implementation yesterday. But the Metropolitan Manila Development Authority says they will no longer have to pay for its fine. Instead, MMDA Chairman Benhar Abalos Jr. says he will pay for it out of his own pocket. Abalos explains this will be a form of help to the commuters and as reconsideration in the onset of the implementation of the policy.
Hindi ko pwedeng i-announce na sasabihin ko bukas o ngayon ay wala kami, sita-sita lang dahil baka maging useless naman, di ba? Lahat lang mag-violate. Kaya hindi namin mai-announce. Pero of course, sensitive din naman kami na dahil first day ito, marami talagang hindi nakakaalam.
The MMDA chief, however, says that starting today, they will already apprehend and fine those who will still violate the number coding scheme. Abalos says this will further ease the congestion being experienced in the afternoon peak hour. Based on the initial assessment of the MMDA on the first day of the implementation of the number coding, traffic gradually improved in EDSA. Before its imposition, traffic in EDSA northbound lane from Ortigas Avenue area extends up to Buendia at around 8 p.m. But now its tail end only reaches Shaw Boulevard. While the northern portion of EDSA northbound from Quezon City Academy has shorter tail end, previously extending to Quezon Avenue, but now ends in Trinoma. Vehicles are already slowly moving instead of full halt between 6 p.m. to 7 p.m., where most number of motorists are recorded, while vehicles with plate number under the number coding were recorded plying EDSA hours prior to its implementation.
Usually, basta ganitong oras, ang traffic ay northbound, papuntang QC. Nag-uuwi ang galing trabaho Makati, uuwi. So the way it is right now, itong flow na to, maganda ito compared sa dati.
Well, the MMDA says they will continue to monitor the traffic situation in the metropolis and provide updates on whether to extend the hours of the implementation of number coding scheme or retain the current policy. Will?
Yes, thank you, Asher Kadapan Jr. reporting live from Quezon City.
The so-called Carmageddon is expected along the stretch of EDSA. With the increase in traffic, the number of road violators is also likely to increase, including the illegal use of EDSA busway, which is exclusive to buses and emergency vehicles. Last year, the Metropolitan Manila Development Authority, or MMDA, recorded nearly 1,000 violators of the EDSA busway during its first month of implementation. Half of them were government workers using their private vehicles or motorcycles. For Senator Panfilo Lacson, politicians should stop feeling entitled when on the road, such as using sirens just to get ahead of traffic.
Una-una, yung abuso dapat iwasan kasi yung entitlement, alam mo yung feeling of entitlement, dapat yun wala Pare-pareho, mapa-government vehicle ka o kaya nagmamadali ka. Dapat pag sinabing bus lane, maging sensitive ka doon sa nararamdaman ng iba. Hindi yung mali ka na, nagmamagaling ka pa, magpapakilala ka pa, at tapos sabihin mo, hindi mo ako pwedeng ulihin. Dapat pare-parehas lang kasi yung disiplina napaka-importante sa tao sa Pilipinas.
Senate President Vicente Soto III adds law enforcement personnel should not be afraid of apprehending politicians or public officers who will be caught violating road rules.
Yung bus lane. Ba't nila pinapayagan? So itong mga driver ng mga sikat, ng mga politiko or mga cabinet officials na dumadaan doon, hulihin ninyo.
For its part, the MMDA assures they are fair in apprehending all busway violators.
Well, pare-pareho po iyan, no? Pare-pareho naman ang ating pagdating sa mga bus carousel na pumapasok. Meron naman tayong mga kamera po rito.
And before we close, we will leave you with a word, giving glory to God. From the book of 2 Corinthians, chapter 4, verse 18, it says, "While we look not at the things which are seen, but at the things which are not seen. For the things which are seen are temporal, but the things which are not seen are eternal." And those are the reasons behind the news, December 2, 2021. I am Herlene Delgado.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
And because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.